Hello and welcome to Scan Central. Today we'll be talking about the knobs that we've learned so far and then how to apply them on ultrasound. So today we'll be using our thyroid to demonstrate few knobs that we've learned so far. So first, we have the patient knob where we input the patient info, the name, the age, the gender, the patient ID, and then the rest. So as you can see, I'm inputting the patient name, patient age, and then the patient gender is very important. Very, very important. Then when you are done, you put on OK. You select with the probe, then you select the thyroid ultrasound. So let's select. So you use the probe knob to select the type of ultrasound that you want to do or examination you want to do. So the thyroid. So first, let's view it in the transverse. So that is the thyroid. We have the isthmus, we have the right and then the left lobes. The trachea is there, the strap muscle is there. So as you can see, we've used our freeze knob to freeze the image, and then we can increase the gain or decrease it. So you can see we are increasing our gain, making the image brighter. We can as well increase the depth of it to make the entire screen bigger or smaller. And then that is our zoom box. You place it at where you want to view specifically to check for maybe a lesion. You can use that. So we can go back. So that is still on our zoom. So we are still on the thyroid. You can see we are still in transverse, and then you assess every lobe perfectly to exclude any lesion. And then the trachea and the isthmus, the muscles, the skin, you can assess all of them. So you can as well use your focus to place your focus or your frequency on a specific area that you want to view. So still in transverse, let's try to put some color Doppler. So you can see it's showing flow on the common carotid artery and then the jugular vein. So we've applied the pulse wave Doppler. You can see the waveform. So we've pressed on the measure button, but before, let's do it dual, because thyroid you have to get the length, the thickness, and then the width. So to get that, you have to do dual. Use the dual knob, get the sagittal view of the thyroid lobe that you want to measure, and then the transverse lobe. You can see we've got the sagittal and then we've got the transverse. So you press on your measure, you have your thyroid length, so you measure the length, then you measure the height. As you can see, the way I'm measuring it, that's the standard way of measuring it. So when you are done, you can manually multiply it by 0.523 to get your volume, or when you go to the machine report, you can get the volume as well. So we have to also place some annotations or labelings. You have to tap on the comment, then you add your right lobe. You can add the common carotid artery, so you can indicate if it's the right side. So right common carotid artery. Then you can have right jugular vein. And then we have the isthmus to the strap muscles. They are all there for easy identification and interpretation. Okay. So we can use the clear button to also clear everything. We can use the report to go and clear everything that we've done. Supposing that what you've done is wrong to you, you can go and clear it, and then you start over. So we are done with that. So try and then measure. Let's see. You can do it. You can use your own self to do the thyroid assessment as well. As you can see, I use my own self to do this examination or this video for you. So I think the first measurement that we did, there was a bit of so I have to do it again so that you can get it correctly. So use the save 1 to save your image. You can use the save 2 to save it in a video form. So let's move on to the left side. So you can measure the left as we did for the right. You can find the volume of the left as we did for the right. So you don't have to use quad. I'm just demonstrating to you. Thank you for watching and subscribe. But before that, you can as well adjust your TGC.